I'm Dr. Michael Cornwell, and I'm the lead physician at the Horsham and Bensalem clinics in Pennsylvania. So reticular veins are, for most people, I think what they would understand or know are spider veins. What spider veins first are veins in the skin that have become enlarged. So reticular vein is a spider vein that's just become much larger. You know, it's simply a larger vein. Reticular also speaks to the layer of skin that if you were to look at these veins under a microscope, where these veins are situated, so they're a little deeper in the skin, but that's more of a kind of a technical aspect of it. But usually, what we think of as vein doctors as reticular veins are simply those skin veins that have been there long enough that they've really just gotten larger. They start to become, instead of like the little fine strands of a spider web, which I think that's where that term came from. The spider veins looking like a spider web. They've started to get thicker, and be like, oh wow, that's a real vein now. As that vein gets bigger and gets stretched out, it now carries a risk of bleeding. So those are the veins that sometimes people will come in and say, wow, this vein just started bleeding on me all of a sudden, or I bumped something and it bled. And when they bleed a lot. Yeah, well, come on in and let us take a look and see what's going on. There is treatment for them. So the treatment is generally an injection type procedure that we call sclerotherapy. So we're actually, with a very small needle, injecting a chemical into the vein. What that chemical is doing is damaging the inner lining of the vein and making it close. So it's a closure procedure of sorts, or a shutdown procedure, which either makes that vein close completely or at least get smaller, which in a lot of cases is kind of the goal that you're trying to achieve. And when you've had bleeding, it's really important, because then you're kind of shutting down the pressure of blood that's feeding into that area. The vein or venous system is very complex. There's hundreds or thousands, when you start to think about the skin veins, thousands of different veins, and they're all interconnected. So if you shut down one or two or an area of veins, the blood flow will shunt around that area or bypass that area and go to other veins within the venous system. And it does that just automatically and immediately. And it does it without any adverse effects. It's not as if, you're going to damage an area. Your body is able to accommodate for that very well. That's a good question. And it does vary. In my experience, I've seen veins that can look better within days, days to a couple of weeks, and then others that can take months, and I think it has to do with probably the size of the veins. The really small and skinny ones are the ones that sometimes you'll see a improvement in, literally, a couple of days time. The bigger ones can take a lot longer. And sometimes those bigger reticular veins, they don't go away completely. It's just, you get them to shrink significantly. And sometimes you do need to come back and treat that area more than once. You can inject a vein more than once to accomplish the goal you're trying to achieve.